Hello everybody, welcome back to my channel. I am Amanda and welcome all newcomers. So today I'm going over my visit to the urologist and what happened and my experience and all that. So I thought that this procedure was going to be a lot more painful and scary than it was. Yes, there was discomfort. Yes, there was some pain, but it wasn't as bad as I had pictured in my head. And is it something I want to go and have done again? Not really, but if I have to have that type of procedure done again, I know that I can handle it. And I know that you can too. So it's not as bad as you picture in your mind. I guess unless you have some serious stuff going on down there, then maybe it would hurt more. But I assume that depending on the level of issues you have down there would determine if you get some sort of anesthesia and where it's done, whether it's done at a clinic or a hospital. So I went in, I gave a urine sample, and they're going to send that out to be DNA tested to see if there are microscopic bacteria and a few other things that do not show up on a normal test that they do in a clinic setting. So we'll see what the results of that are. But when they tested what they could in the lab, my urine was normal, thank goodness. So the procedure, like I said, I was able to get through it. It wasn't as bad as I thought it was going to be. And it wasn't as long as I thought it was. And I was able to see on the screen what my bladder and urethra look like. Interesting. What they do is they put water into your bladder, because if not, your bladder will collapse and then they won't be able to see anything. And it's a scope, and it comes in one size, and it goes in your urethra. Well, they put, I don't remember if I said this, they put betadine, is that what it's called? Betadine, whatever, that stuff that they put on. They use that. There was a point right before they entered my bladder where it hurt enough for me to say, can you stop a minute? And they did, and they weren't mad or anything like that. They just said, okay, breathe, try to relax, it won't hurt as much as if you relax. So I was able to breathe, and okay, and I said, all right, let's do this, and once it went in, I couldn't even feel it. But I was able to see inside on the screen, and it's actually interesting. So basically, they were testing, or they were addressing overactive bladder, dysuria, which is painful urination or burning urination, urinary frequency, which is like overactive bladder type stuff, I don't know if I'll pronounce this correctly, but I'll try. Microhematuria, which is blood in the urine. It's more like microscopic blood. You may see it in the toilet. You may see it in your urine. You may see it when you wipe, type of thing. And it will come from your urethra specifically. If you're a woman and you have periods, or you're just a woman, because you can not have periods and still have bleeding from your vaginal area, you have to make sure that it's one or the other, or it's both, but coming from the specific location. So just so you are aware. And pelvic pain. So it was called a POC urinalysis dipstick with Cystoscopy. At the end, I was given ciprofloxacin, which is Cipro, you know, just in case, basically. And they gave me some care instructions for blood in the urine. Oh, it's actually shorter here in the sentence. It says blood in the urine or hematuria. So they just took the micro off. Okay. So it says may make the urine look red, brown, or pink. There may be blood every time you urinate or just from time to time. You cannot always see blood in the urine, but it will show up in a urine test. And that's why it's good to have the test done, because it doesn't always show. Blood in the urine may be serious. It should always be checked by a doctor. They may recommend more tests, including an x-ray, a CT scan, or a cystoscopy, which I had. Now, blood in the urine can be the sign of another problem. Common causes are bladder infections and kidney stones. An injury to your groin or your genital area can also cause bleeding in the urinary tract. Very hard exercise, such as running a marathon, can cause blood in the urine. Interesting. Blood in the urine can also be a sign of kidney disease or cancer in the bladder or kidney. Many causes of blood in the urine are caused by a harmless condition that runs in families. This is called benign familial hematuria. It does not need any treatment. Sometimes your urine may look red or brown even though it does not contain blood. For example, not getting enough fluids, dehydration, taking certain medicines, or having a liver problem can change the color of your urine. That is true. I have taken things that have changed the color of my urine. So you got to be careful to keep track of what goes in. And if it's like say you eat beets or something, that's probably going to turn your urine a little red, you know, something like that. Eating foods such as beets, that's funny, rhubarb or blackberries, or foods with red food coloring may make your urine look red or pink. Follow-up care is a part of your treatment and safety. So you need to follow up with every appointment, make sure you go, get the tests done, because you never know. So it says call your doctor now or seek immediate medical care if you have symptoms of a urinary infection. So you may have pus in your urine. That sounds unpleasant. You have pain in your back just below your rib cage. This is called flank pain. You have a fever, chills, or body aches. It hurts to urinate. You have a groin or belly pain. You have more blood in your urine. Watch closely for changes in your health and be sure to contact your doctor if you have new urination problems. You do not get better as expected. I was referred to a place to get my kidneys checked out. I don't know what exactly they are looking for. I didn't ask. I was trying to just get through the procedure, and everything after that, I was more like, yep, yep, you know, type of thing. But I'm sure they're probably looking for like kidney stones or something that involves the kidneys, if that's what it is. But I was referred for that, so I'm waiting for a call for that. And I was also referred to a spine rehab, physical therapy spine rehab center. It's for a specific type of physical therapy for my pelvic floor to help with the pain and everything that I'm experiencing. It's not like going to regular physical therapy, is what was explained to me. So, and multiple visits requested. Also, I was given let's see, IC diet stuff. So let me just go over that. Dietary changes. So fluid intake, I'm actually really good at drinking enough water. In fact, a lot of times they think I drink too much water, but when I say this is how much I drink, to like when I told the urologist the first time, my first visit, how much water I try to drink in a day, she said it was fine. So I'm going to go with that. So there's a list here of bladder irritants. Oh, sorry, before I go there. So I just want to talk about what it says here to monitor when you're monitoring your fluid intake to make sure that it's normal color. So normal urine color should be pale yellow. If the urine color is darker than pale yellow, the patient may need more fluids. If the urine color is clear in color, the patient may be taking in too much fluid. Many women monitor their diet and consume an increased amount of fruits and vegetables. These types of foods contain large amounts of water. It may be necessary to take these foods into consideration when monitoring fluid intake. So when you eat a lot more vegetables, because they're like made of water basically, and also fruit. I don't eat a lot of fruit. I prefer the vegetables. So just monitor the color of your urine and just make sure that it isn't, that if it changes color, you have an idea of why. Did you increase, certain types of foods? Are you taking certain types of dietary supplements that may change your intake or medications? The color or medications. So just keeping, a check on that and just make sure, okay, I started a new medication, my urine changed color. So then you can say, hey, this happened. Should I increase my water or should I just wait for my body to get used to it or something like that? So just be aware of that and be in contact with your doctor to make sure that you are drinking the right amount of water for your body. So bladder irritants. Many people are unaware of the various foods or fluids which are bladder irritants. For that reason, it is important to discuss consumption of food which may make the symptoms worse. Some of the bladder irritants are any product with caffeine. Decaffeinated products contain some caffeine, but not as much as caffeinated products. So if you're going to drink caffeinated products, you need to limit how much you actually take in. So if you are a coffee drinker and you have these issues, it might actually be good to switch to tea or decaffeinated coffee, or only have 1 cup, like 8 ounces of coffee a day, because it can cause severe bladder issues for some people. So tea, cocoa, cola drinks, Mountain Dew, or any beverage known to have caffeine. Tomatoes or any product with tomatoes, spicy foods, alcoholic beverages, tobacco products, chocolate, citrus fruits, carbonated beverages, milk, artificial sweeteners, over-the-counter stimulants, no-dose, or other similar medications. And that's just like a small list of things, Now, I drink tea, but I drink decaffeinated tea, and I only have 1 cup a day, and every so often I might have 2, but it's really low in caffeine, so I think I'm good with that. The other thing is like spicy foods. I like to put some spice in some of the foods that I make, and what I've done is I've minimized that to like the minimum amount that I could possibly put in. That way it's not how it was and it's not too much. And because I like some spices, like I don't actually go out and buy eat Szechuan or something like that, but I like to put a little bit of like smoked paprika, cayenne, chili powder type of stuff in. So I just, like, when I say a little bit, I mean, what is it, 1/8 of a teaspoon? I think that's as low as it goes, so that is where it is. let's see, tomato products or tomatoes. When I make soup, vegetable soup, I like to sometimes put diced tomatoes in. So what I'll have to do from now on is make sure I get the blandest crap they have and add my own spices in. And another thing that I can do is, instead of using tomato products to limit that, I will use more beans or lentils or something like that to put into the soups I make, because I like a hearty type of soup. I don't like it all fluidy. I like fluid in it, but just not more fluid than food, if that makes sense. I like it the other way. Chocolate, I really don't eat chocolate anymore. Like, that is my kryptonite, and I gotta be really careful with that one. Milk, I drink almond breeze. I don't drink like regular milk. I only use it if I'm cooking something and it requires that type of milk, because sometimes you need a thicker milk, basically a fattier milk, to make certain things, and it tastes okay, at least for me. And I don't drink a lot of the milk. I have it, and I sometimes use the almond breeze for cooking as well. It really depends. So, but I do mostly use the almond breeze, whatever kind of milk it is. Okay, so the IC Smart Diet, and this is something like that can be looked up. This is just a piece of paper of all the different things on here. It looks like it's backwards. I wonder if it'll look like that when I watch the video back. The IC Smart Diet. Many people with I don't even know how to say that. It's STITIAL cystitis. So, okay, I see why it says IC. Find that changes in their diet can help to control these symptoms and avoid flare-ups. Typically avoiding foods known to be common bladder irritants such as coffee or citrus products is a good idea. This helpful guide can help you make IC smart meal choices. Keep it handy for easy reference when dining out or when preparing meals at home. So I'm going to go over this. So fruits. So the friendly ones are bananas, blueberries, honeydew melons, watermelons, raisins, gala apples, Fuji apples, and pink lady apples, pumpkins, and pears. I'm going to read the IC ones, and then I'm going to put like this information in the description anyway, and that way you can read the ones to avoid. So for vegetables, potatoes, sweet potatoes, yams, most beans, bell peppers, broccoli, carrots, asparagus, cauliflower, celery, lettuce, mushrooms, peas, radishes, squash, and zucchini. Milk/dairy. Milk and American, cottage, mozzarella, mild cheddar, feta, ricotta, and string cheeses. I'm not a big cheese eater, and the only kind of cheese I really like is sharp cheddar cheese. So I'm cool with that. It's good. Carbohydrates/grains. Wheat, rice, and corn pastas. Quinoa, oats, buckwheat, matzo, don't even know what that is. Polenta, I've heard of that, but I don't know what that is either. Grits, couscous, millet, spelt, and breads, except those listed below. Let's see. Meats/fish. Chicken, turkey, beef, pork, lamb, shrimp, tuna, salmon, and deli meats. Gluten and color-free. Let's see. Nuts and oils. Almonds, cashews, peanuts, and most oils. Beverages. Water. Whole, low-fat, non-fat, lactate, rice, goat and almond milk, blueberry and pear juice, vanilla, coconut, and caramel milk shakes, and chamomile, peppermint, and herbal teas. Seasonings, garlic and other seasonings except those listed below. And basically avoid food additives. So I know that with the milk, it kind of overlaps because it says you can drink whole milk and stuff like that. I think what they're saying is if you're going to drink whole milk, don't drink a ton of it all the time. Drink the appropriate amount for your daily intake. You know what I mean? That type of thing. So that's why it's good to go over this with your doctor to make sure that it is correct. I just want to make sure that I went over everything. So I went over the referrals, and I do have a follow-up appointment in June. I forgot what for. I think it's to, oh yeah, it's a follow-up to the referrals, and I think the kidney exploration thing. I'm calling it kidney exploration because they're trying to figure out, you know, so yeah. Yeah, so I think that was all for that one. Let's see. Yes, it is. So, cool beans. I know that was a long one, but I wanted to make sure that I got that information in there. And of course, this information with these pages, I'm going to put in the comment section below, description box, so you guys have that for reference. And also the different things that I went over, like the things that they tested for and the name of that medication they gave me, that stuff. So you guys have that for reference. So yeah, it was not that bad of an experience, honestly. It can be handled for sure. And I totally made it bigger in my head than it actually was. I tend to do that. It's called catastrophizing. And I know that I'm not the only person who does that, so don't feel bad. You know, it's okay to be nervous to go in for a procedure you've never had that may cause some pain and discomfort, because it did. But I made it through, and so will you. All right, so that is the end of this video, and I'm going to go over what happened when I went to the women's health place, but not in this video. I'll make a separate video for that and get that out to you hopefully tomorrow. Hopefully I can do that one tomorrow. I actually am here alone right now, so it's easier to make a video without feeling like everyone's hearing every word I say. I get a little nervous when people are like listening in or watching me make videos. I'm like, why are you watching me? I don't know. Anyway, thank you for watching. Thank you for stopping by and hanging out with me for 23, almost 24 minutes. I love you all. Please take care of yourselves. Peace and love to everyone out there. And I will see you in my next video. Bye, guys.